Hey, my name is Meagan Clanahan. I am the co-owner of Houston Moms, and we are bringing you another health video sponsored by our friends and partners at UTMB Health. They are preferred providers for the Southeast Bay areas, Galveston, League City, Pearland, all you folks down in our Southeast. But we love some UTMB Health. And today we are covering a topic that we haven't really covered before. So I'm excited to dive in. And I have a great guest with us today, Dr. Gerber. He is a pediatric urologist with UTMB Health. And thank you so much for joining us today.
Thank you for having me. I appreciate the invite.
Yeah, absolutely. So tell us a little bit about yourself. I understand you're a dad, but what area do you practice out of, and what's your like specific role with UTMB Health?
So I am a dad. I've got two young boys, 3 and 5. They are great, lots of energy,
Yeah.
and they've required some urology with circumcisions and whatnot. So they are well versed in my specialty. My practice is based out of Clear Lake, so I am down in Webster with the UTMB Clear Lake campus. Um, I
Perfect.
got your next question.
Yeah, no, you're good. So you're a pediatric urologist. What special kind of training do you have to go through to do? I mean, there's urology and then there's pediatric urology. Can you kind of explain the difference?
Right. So urology is going to encompass adult and pediatric, all specialties, covers oncology, covers pediatric urology, covers female urology. And then if you want to do pediatric urology, you have to do an extra fellowship after the 5 year urology surgical residency. So it's a 2 year program where you train specifically only with pediatric urology conditions. For those that aren't familiar with sort of urology, urology basically is anything that the urine or genital involvement. So anything the urine touches and the genitals. So kidneys, the tubing that connects the kidneys to the bladder. So we'll touch on kidney stones, urinary tract infections. And then as far as the genitalia, that would be for boys, the penis and the testicles. There is some overlap as far as girls with some pediatric gynecologic care, but for the most part, it's very heavily tilted towards boys.
Perfect. And I should have said this on the onset, but if you're watching and you have your littles around, we are going to be using anatomically correct terms here. So if you want to know more about this topic, but I may want to suggest that you come back, save it, and then come back to it. I'll also put like a little trigger on here. Not that it's a trigger for us to talk about it, but like in case you don't want to have a conversation with your 3-year-old in the car right now, I totally get it. So when we think, pediatric urology, and we think the first thing I kind of think of is circumcision. So, can you explain what circumcision is, the process? Like, what do we need to know as moms or parents if we're like expecting a baby boy?
Yeah, absolutely. So circumcision is the most common procedure done in the country. Roughly 80% of American boys are circumcised. If you go to other countries across, the globe, there's going to be some that are similar and some that are totally opposite. They just don't circumcise. Circumcision at the end of the day is a personal choice. We'll get into it a little later as far as some of the health benefits of circumcision, as well as rationale for pursuing a circumcision. But at the end of the day, it really comes down to a personal preference that could be based on other men in the family, whether they're circumcised or not. Could be for religious reasons. Could be that's just what the parents know, and they want the boys to be just like that.
Okay, so as we're thinking, like when I have twins for reference, a boy and a girl. And so when I had my baby boy, I had to like s- send him off and like,
Right.
what should we? I mean, that was kind of traumatic. Like he just got here, and I'm like, okay, so you're gonna go do this. What? How do you talk to your parents and your moms who are just like, oh, I want this, but I don't know. Like, how do you
Yeah.
ease their fears?
I hear that a lot about, well, I didn't really give it much thought. And then they came in, it was, it was immediately after the birth, postpartum, and they said, do you want a circumcision? I really didn't give much thought to it. And they sort of took the baby away and the baby came back circumcised. For me personally, when we were talking about circumcising my boys, that was, I mean, there was never any question for us because we did it for religious purposes. But with that, it has to be scheduled ahead of time. You sort of
Mm.
give the person who does the circumcision, which I didn't do for my own. I don't generally do surgery on my own children. I left it to somebody else to do. I did supervise. I did make sure it looked nice, but we had, I guess, we're fortunate enough to sort of be able to notify, hey, this is sort of the due date, make sure you're available. And it had to be done about a week after.
Okay.
Not everybody is going to fall into that boat, but I do think that it helps to think about it beforehand.
Yeah.
Circumcision, I don't think should be something you feel pressured into. It should be something you think about, and hey, this is something we want. Parents should know that the hospital right after birth, within the first day or two, is not the only time that a circumcision can be done.
Mm.
Different places have different age cutoffs. For me, in my practice, I'll circumcise in the office in the exact same way it'd be done in the hospital. But me doing it, I do it all the way out to 8 to 9 weeks of age.
Oh,
So
wow.
there's plenty of time, even if you don't want it, and then a week after you say, you know what, actually, I think we do. Well, you can't just sort of go back into the hospital and say, we forgot, we want you to go back and do it. But there are providers around that are able to do it later on.
I did not know that. Okay, because I kind of thought it was just like we must do now. We must go now. And we're already like faced with so many decisions as parents, like new parents, and we're just a little overwhelmed.
Yes,
Um,
absolutely.
so I think that's good advice though for if you know that you're having a boy, if it's not a surprise, this is something that you should be prepping for. So let's say we circumcise our baby. What does it look like in terms of aftercare? Are there any complications we should be aware of? You mentioned it was what the number one procedure
The
or
most common procedure in the country. Yeah.
okay. I've also heard this, and you could probably like so I had a kidney stone once, and
Yes.
somebody said, they're like, there's three most painful things you can have. An adult circumcision was on that list of. So you probably don't. I mean, you can do what you want, but it sounded pretty painful. The kidney stone was
Yes.
painful.
Yes. So fortunately for kids, it is better tolerated. I think most people on this forum would probably not argue that adult men are some of the bigger babies as far as handling pain. So fortunately, no comment there. Fortunately, the actual babies don't feel so much pain. I will say that the younger they are, the less pain they feel.
Mm,
Those nerves have just not quite developed yet, so it does make it less painful. Uh,
okay.
Plus, they're a little less aware. So the older they get, like when I do the 8 or 9 week olds, they will cry a little bit more, but it's not due to pain, because we know that as soon as we're done, we pick them up, we get them out of we have to strap them down onto a board so they don't, kick around while we're, doing the procedure for safety purposes. But as soon as we
Right.
pick them up, they stop crying. So it usually tells you that's probably not pain. It was more they didn't like the process of, having to be held down.
Right.
So,
And
yeah.
then what like kind of complications, like if any, like, as they're healing, like what is kind of the aftercare for circumcision?
So complications are pretty rare when you look at sort of major, more surgical complications. There's obviously going to be pain, bleeding, infection. There is always that story somebody will Google and hear about where there's, injury to the actual penis itself or one of the structures associated. That is exceedingly rare, especially when it's done in the hands of somebody that does a lot of these.
Mm,
So it is important to find somebody that is well versed in doing circumcisions.
okay.
Probably the most common complication would be what I lump into poor cosmetic result, meaning it just doesn't look that nice. Again, that can be mitigated if you choose somebody that does a whole lot of them, and even more so somebody that's specifically trained for, operating and evaluating and understanding male anatomy and pediatric male anatomy.
Yeah.
Those complications would be where the skin gets a little stuck where you don't want it to. Those are called adhesions. Those are extremely common. And then one of the other common ones would be too much foreskin left over, so they don't look fully circumcised.
Okay.
That rate has been reported to be somewhat high. I personally don't see that in my practice. I fortunately haven't had any where we've had too much foreskin left over, but adhesions are definitely going to be the number one, and those are pretty easily treated in the office. We can just peel those down,
Okay.
but proper care afterward is going to be the most important and best way of preventing those complications.
Okay, so what does that look like? I can't remember. Take me back 15 years from now or ago. Like, was there an ointment? I don't recall.
Yeah.
How do we
So
care?
So what there will be on there will be a little bandage wrapped around the incision. That's just to keep that incision moist and free
Mhm.
from having any pee really burn on that area. And then you're going to need to use Vaseline or Aquaphor. I say every diaper change for 2 weeks. And the most important part is that you make sure you get it on the correct portion of the penis. I have heard a lot from when I see them for some of these, complications like adhesions and whatnot. They say, I really wasn't told what to do. They just said, put ointment on it. And oftentimes what they'll say is put ointment on a gauze and just sort of cover it, or put ointment where the penis will meet the diaper and just close the diaper.
Yeah.
I advise parents to be a little bit more specific with where they're putting the ointment,
Okay.
because the adhesions are mostly going to form where the head of the penis meets the little ring of pink skin that you'll see afterwards.
Uh-huh.
It folds up, and if it's touching and never gets pushed down, it'll heal together. So I tell parents they need to push down on the baby's little fat pad, the area right above the penis.
Okay.
And you push that down, you make sure you see the whole head of the penis, and you put a whole lot of Vaseline or Aquaphor all over the top. There's no such thing as too much. You use a lot. You can do it every diaper change for 2 weeks and should be good to go.
Okay. I just had a flashback and I'm like, I think I did the gauze situation.
So yeah,
I
it's
didn't know
very
what I
common
was
to be told that.
doing, but it's not like I don't know what's happening these days. So it is like now it's done. Um, so so like from a urology, like circumcision, obviously being a huge part of what you do. How many have you
Mhm.
done, by the way? Do you have a count?
I don't have a count. In the last 2 days, I've done, well, these are in the operating room. I've done 8 or 9 in the last 2 days, but in the office, I do have a circumcision clinic that I have 3 times a month, and we'll book about 10 circumcisions per day on those.
Goodness. Okay, so we're well into the thousands. So you are
Yes.
definitely the expert. But just real quick, for besides, circumcision, you mentioned, kidneys, if we have, kidney stones, is that within your realm of what you do?
It is. Fortunately, pediatric kidney stones are not very common. They are becoming more common based on diet and increased rates of obesity, and then the heat. All these factors have been long known and well studied as far as increasing the rates of kidney stones, dehydration, poor diet, heavy and high in salt, basically the American diet. And if you live in the
Yeah.
South, it's hot and you get dehydrated quick. Um, those are all increased risk factors for forming kidney stones. Unfortunately, pediatric kidney stones are on the rise. Still not nearly as common as adult, but we do see those, and that is something that I would treat and take care of. The other common pediatric urology, sort of more specific things that I see, undescended testicles. So that's going to be about 1 in 33 newborn males are going to have an undescended testicle. So
Okay.
3%, very high rate. Urinary tract infections, bedwetting. We see all that stuff. As far as the penis, the circumcision revisions. So if you're not happy with how the circumcision went, you don't think it looks right. So, somebody like myself would be the right person to see, and then also hypospadias, which is probably what, if you had to pick a single diagnosis that pediatric urology sort of was born out of, it would be hypospadias, and that's where the pee hole, the child is born with the pee hole too low, so it's not at the tip of the penis, it's further down, and it can be anywhere from under the scrotum, through the scrotum, or anywhere along the penis.
Okay.
And so that's about 1 in 200 to 250 newborn males. So
Wow.
also pretty common. And the
Okay.
rates are rising also, probably because of, diet and, environmental factors that we're being exposed to. So,
Okay. Things I did not know about.
yeah, it's a lot.
Thankfully, obviously, like the bedwetting and UTIs. So I think as we always like encourage on these videos is that you have like a cemented relationship with a primary care or general practitioner, because I assume that's how you're getting most of the referrals, right? So if a parent has a trusted GP that they see, then they're like, oh, like this may be more than just wetting the bed. This could be an indication of something larger. We're going to send you on over to Dr. Gerber. Is that kind of
Mhm.
how it works?
Usually, sometimes, and everybody's pediatric practice is a little bit different. Some will have a little bit more bandwidth to really sort of do those initial steps on trying to change some behaviors and do the initial modifications to try to get, for instance, bedwetting to be treated. And if it's, just not going away, or they sort of, some just have a certain age, hey, if you get to age 7 and it's still not gone, I'll send you to go see the specialist. Uh,
Okay.
so I do see a lot of bedwetters. It's very common, and fortunately, we can do a lot to make things speed up as far as going away.
That's wonderful. Um, okay, I have taken up too much of your time today, but we could keep going with a bunch of other questions. But I am so appreciative. I have to tell you, we always get these bios before we do these videos, and your bio really stuck out at me. We are going to pop it in the comments below, but I loved what it said. Dr. Jonathan Gerber is a fellowship trained pediatric urologist who believes that a child is the most important person in the room during a clinic visit and should be treated as such in order to alleviate the usual fear of seeing a doctor. Um, I think that's the type of doctor I want my children to land with. So I appreciate that. Can you just share a
Oh,
little
thank
bit
you.
why that's so important to you?
Well, it's awkward. Nobody likes going to the doctor. Kids can sometimes, find that environment to be scary. And then in my specialty, I mean, it's literally every patient is going to have a genital exam. And that's, as a parent, you tell your kids, nobody looks, nobody touches unless mommy or daddy or the trusted caregiver, if it's a grandma or grandpa, says that it's okay and they're with you and they've been given permission. So that's one of the things I tell the kids when I'm about to do the exam. I say, you want mommy or daddy to stand up at the bed with you? And they usually say yes. They said, we're going to have to take a look down below. Remember, I'm a doctor. This is what I specialize in, and mommy and daddy are right here. And I've asked them, and they said that it's okay, and they're going to be right here with us while we do the exam. Um, because it's a sensitive area, and
Yeah.
kids are well aware of that. And you got to do everything you can to make them comfortable and understand that in certain settings, with the doctor, when they're checking on things, that's okay sometimes.
I think that's so important, and probably the most important thing that somebody can get out of this video too. I have a pediatrician who has always said, it's only okay that I'm touching you because your mom is right here and she said
Mhm.
it's okay, and that consent, huge. And my kids just they're fine with it because they have like a trusted relationship. And so thank you for continuing to like build trust with your patients all around UTMB and the Clear Lake area. Dr. Gerber, thank you so much for joining us today. I really appreciate it.
Thank you. I appreciate you having me on.
For sure. And so I will drop comments and links in the comments below with a link to Dr. Gerber's bio because I want you to read it. I really, really enjoyed it. And then to urology, if you do not have an established primary care physician. Let's do that. So I'm going to pop a link where you can get one at UTMB Health. We will be back next month with hopefully cooler weather, and we will have another important health video for you. So until then, we'll see you next time.